So penile cancer is a rare GU tumor in developed countries, although in developing countries it makes up 10% of male cancers. And recently immune checkpoint inhibitors have been approved for different cancer types, and we're really interested in knowing how do immune checkpoint inhibitors um work in patients with penile cancer. And that's how we started our study regarding penile cancer. The reason we wanted to investigate immune checkpoint inhibitors in penile cancer is because we know that tumors of penile cancers, the tumor cells would have PD-L1 expression. We know that the tumors are infiltrated with lymphocytes, and we know that there is a high percentage of HPV infection as well, 30 to 50% in the case. And we know that immune checkpoint inhibitors work in HPV in infected tumors. And thus, really, we were interested in the outcomes of patients with penile cancer. So what we did is we reached out to 24 institutions as part of the Global Society of Rare GU Tumors. And we collected data, baseline data on the patients, and we looked at the overall survival, the progression-free survival, and the overall response rate. So key findings, we had 92 patients in our cohort. 90% of the patients had metastatic disease, meaning it was metastatic to distant organs or distant lymph nodes. And 80% of the patients received immune checkpoint inhibitors in the second line setting or beyond. And looking at clinical outcomes, the median overall survival was 9.8 months in the overall cohort. The median progression-free survival was 3.2 months in the overall cohort, and the overall response rate was 13%. And examining different potential biomarkers, we looked at HPV status, we looked at neutrophil to lymphocyte ratio, and presence of visceral metastases. We did not see differences in outcomes for patients with HPV or without HPV infection in the tumor. What we saw is that patients who had a high neutrophil to lymphocyte ratio and absence of visceral and presence of visceral metastases, those patients tend to do worse than patients who had lower neutrophil lymphocyte ratio and did not have visceral metastases. As for the safety outcomes, 29% of the patients in our cohort developed immune-related treatment-related adverse events, and when we broke down the treatment-related adverse events by type of therapy, the patients who received single immune checkpoint inhibitor had 21% treatment-related adverse events versus 31% in patients who received dual immune checkpoint inhibitor, anti-PD-1 plus anti-CTLA-4, and that number went up to 75% in patients who received anti-PD-1 and anti-CTLA-4 plus a targeted therapy with a TKI. And thus, we saw minimal activity across all three groups, but I think that was a clear message to us that combination therapies, although might be promising, we should be careful for the toxicities that they may have on the patients. So I think the direct impact of this study is at least when a patient with penile cancer walks to the clinic and presents and there's a discussion about immune checkpoint inhibitors, the patient and the oncologist now know what to expect in terms of outcomes, and that would guide the treatment selection in the clinic. I think that's the direct impact. Another impact would be our study is generating hypotheses for scientists and physician scientists to explore more a translational component and to understand why certain patients respond to therapy and why certain patients do not, so that we can guide treatment selection. I think the overall message is that penile cancer is a very rare GU tumor, and at least in developed countries, and the key in understanding rare GU tumors like penile cancer is collaborations with other centers. In this study, we leveraged the Global Society of Rare GU Tumors consortium, and we invite other centers to participate in this consortium so that we can generate as much as possible meaningful information to patients with penile cancer. And just to close, I think the key finding is that there's a few patients who respond to immune checkpoint inhibitors, and we should be careful in treatment selection, and combination therapies, although are active, we should be careful in the safety profiles that might be generated.